if you list the cardinal symptoms that we have in a cardiovascular system case, you have chest pain, palpitations, dyspnea, syncope, pedal edema. You could have other symptoms also, but these are the common symptoms that we are going to analyze. Coming on to the first symptom that we have is chest pain. So chest pain is a very important and common symptom of cardiac disease, what we call it as angina. So angina is the cardiac chest pain that is most often that we get, but we could have other causes of cardiac chest pain also. So the chest pains can be due to other causes of cardiac chest pain, or else it could be due to anxiety, it could be due to respiratory diseases, musculoskeletal diseases, and gastrointestinal system diseases also. So if you see, you have a large number of diseases where you have cardiac causes of chest pain, the most important one being the coronary artery disease, where you have angina and myocardial infarction. Valvular heart disease like mitral valve prolapse, very important cause, aortic stenosis and aortic regurgitation. Pericarditis, one of the important causes of the cardiac chest pain that you have, and hypertrophic obstructive cardiomyopathy can also cause cardiac chest pain. Vascular diseases like you have the dissection of the aorta can produce chest pain. Pulmonary diseases, most important being pleuritis, pleurisy, pneumothorax, pulmonary embolism and pneumonia. These are the pulmonary conditions which can produce chest pain. The gastrointestinal causes of chest pain include reflux esophagitis, diffuse esophageal spasm, peptic ulcer disease, pancreatitis and cholecystitis. These are the gastrointestinal causes of chest pain. The musculoskeletal causes of chest pain, you have something called as a costochondritis, or what we call it as the teat syndrome. Arthritis of the joints, muscle spasm, sometimes bone tumors and metastasis to the bone. Very commonly we get metastasis to the bone that can produce pain. The neurological causes, very important is your neuralgias, especially the post-herpetic neuralgia. We get the intercostal nerves that is getting involved and you get pain. Also you can get diabetic truncal neuropathies that can also produce the chest pain. Very important cause, truncal neuropathies. Functional disorders can also produce chest pains like anxiety and depression. The patient can come with chest pain. So these are the important causes of chest pain. We have to know the differentials. We have to know how to differentiate a cardiac chest pain versus a non-cardiac chest pain. So the potentially life-threatening causes of chest pain, which is very important and we have to always keep in mind, and we have to rule out these causes first. The most important one is the acute coronary syndrome. It could be MI, it could be non-ST segment elevation MI, you could be having ST segment elevation MI. Unstable angina, that's a very important cause. If you miss it, the patient can succumb. Pulmonary embolism, aortic dissection. So these are important causes from the cardiovascular system that we have to always remember. From the respiratory system, we have to remember tension pneumothorax as an important acute, potentially life-threatening cause which can manifest with chest pain. Esophageal rupture, what we call it as Bohr-Haave syndrome, is an important emergency that has to be thought of. Other important causes remain, like you could have aortic dissection, myocarditis, acute chest syndrome like in sickle cell anemia you can have a crisis. Gastrointestinal causes like perforated peptic ulcer, acute pancreatitis and acute cholecystitis, these are potentially life-threatening causes of chest pain. The other causes are not life-threatening, like you have the gastroesophageal reflux disease, peptic ulcer disease, the pneumonia and pleuritis, the teat syndrome, the musculoskeletal chest pain, the fracture of rib or trauma secondaries, or you have something called as a Bornholm's disease. You have something called as a Texeda's twinge, that is the precordial Katz syndrome, the thoracic radiculopathy that could occur due to that. Emotional conditions like anxiety, neuritic post-herpetic neuralgia, or zoster, diabetic truncal neuropathy. These are non-life threatening causes. So this is one other way to classify the causes of chest pain. Now the most important thing that you have to remember is to differentiate a cardiac chest pain versus a non-cardiac chest pain. Basically, it is the angina, the ischemic cardiac chest pain versus the non-ischemic or the non-cardiac chest pain that we have to discuss. So what are the things that we understand in that? One is the site. Usually the cardiac chest pain is central, whereas the non-cardiac chest pain, be it pleuritic, are peripheral and localized. The character of the cardiac chest pain is considered as tight, squeezing, constricting, heavy sensation. If the patient says any of these words, says he feels heaviness in the chest or tightness in the chest or a squeezing sensation, that means it's a cardiac chest pain that we are dealing with. Whereas the non-cardiac chest pain, when we are saying, basically we are talking about the pleuritic chest pain there, it is sharp, stabbing or catching in character. The precipitating factors for angina are exertion or emotion. Whereas non-cardiac chest pain is spontaneous, there is no precipitating factor. Radiation, the cardiac chest pain, that is angina, usually radiates to the jaw, the left-sided jaw, the left-sided shoulder, the neck of the left side. Whereas the non-cardiac chest pain, usually there is no radiation. Relieving factors, very important. Cardiac angina is relieved by rest or on taking nitrates. Patient consumes nitroglycerin, that relieves. The non-cardiac chest pain are not relieved, usually by rest or nitrates. The exception you have to remember, your esophageal spasm. Esophageal spasm is one non-cardiac condition which is relieved by nitrates. So this is, nitrates will relieve this. So this is one thing that you have to remember, that esophageal spasm is also relieved by nitrates. The associated features that could be there in case of a cardiac chest pain is breathlessness and diaphoresis, whereas non-cardiac chest pain, if it is pleurisy, they may be associated with fever, cough with expectoration or pain which is on one side. If it is gastrointestinal, there could be associated nausea, vomiting, hematemesis as a symptom that could be there. So it's very important for us to differentiate a cardiac chest pain, especially the ischemic cardiac chest pain versus a non-ischemic cardiac chest pain, and these are the factors that has helped us to differentiate the site of the pain, the character of the pain, the precipitating factor, the relieving factor and the associated